This is particularly true when you're working on call out of hours or on the weekend or on nights when there's just significantly less staff around, especially on nights when I'm the only doctor covering 250, 300 patients. I've had 2 recent night shifts that have just completely shifted my experience and understanding of what it means to be a doctor. First one was in my previous hospital when I was dealing with just a particularly unwell patient who was requiring all of my mental and physical energy, both of my hands, to carry out all of the activities in front of me. And then a nurse came up to me actually and told me about a patient experiencing chest pain with ECG changes, which is significant for something like a heart attack. And then whilst I was trying to manage that situation, a patient fell and hit their head and was bleeding. And I was the only doctor around and the only person who knew about these 3 things. And having to, appropriately escalate these different patients and come up with a prioritization and treatment and management plan for all of them was unbelievably stressful.
Exactly. So there's a lot of stress working as a doctor. I'm internal medicine doctor, so of course we work on the floor, work in the ICU, and we have to deal with rapid response, is what we call it. And somebody would become very sick suddenly. But although I don't have that kind of experience where there's like only me and then the patient becomes really sick and there's an RRT, there's going to be a lot of people that actually coming in and then help you. So you're not alone. That was nice actually. And then you go through that, the intern year, the senior is going to be the one that kind of like make decisions on what to do, things like that. And then once you see that quite more often, you usually will get used to it. Either you have enough mental resilience to actually get used to it, or you actually go away from it saying that this is not for me, which is understandable. I don't like it either. Some people can get adrenaline and dopamine rush and enjoy that, enjoying the save. For them, it's like more like a thrill. And so it's really different, your specialty. The problem is that you have to go through all this and then you choose your specialty afterward. This is what I think. I think you do have to have that level of mental resiliency if you want to become a doctor. It's almost as if like if you want to become a pilot, like you want to fly an airplane, you should not be colorblind. It would be very difficult for somebody who doesn't have that strong mental resiliency when it comes to all these things. It would be very hard without that.